Hi, my name is Gina Gray and I'll be doing the Tracheostomy Care video for Nightingale College. So I have my clean gloves, it's my supply right now. Tray kit. This is gonna be my normal sterile saline. This is gonna be my hydrogen peroxide. This is my patient, and I already put on the tracheostomy. Okay. So before we do anything, before we even enter the patient's room, we wanna make sure that we have the provider's order for cleaning the tracheostomy. So once we confirm that they have the order, we can go into the patient's room and do the procedure. Okay, so we go to the patient room, we provide privacy. We want to put on hand sanitizer or wash our hands for hand hygiene, and we're going to be introducing ourselves to the patient and asking the patient for their two patient identifier, like their full name and their date of birth. Okay, since that's done, we want to explain to the patient what the procedure is gonna be, how long it's gonna be, what we expect of them to do, what he should expect from us, and how he's gonna be kept safe during this procedure. Okay, so for this procedure, actually, the number one thing is to have a baseline of the patient. So we need a patient assessment. So for the patient assessment, we need to do vital signs, and we need to check their cardio and pulmonary. Make sure that the patient is vitals are within range. We're gonna have the oximeter on the entire time to make sure that no huge drop in oxygen is occurring. Okay, and then for patient safety, what we just want them to do is, if they feel any pain or discomfort, we want them to raise their hand to let us know that there is, and that they want us to stop or like pause the procedure. Okay, so for this procedure also, we want to oxygenate the patient first, and do unnecessary suctioning of secretion. If we do hear some secretion there, we must suction it first. Okay, now that we're ready and we've already discussed with the patient and the procedure, want to put the bed in a good working height for us. And then what we want to do is put the patient in a semi-collar's position about 30 degrees, and this is after hyperoxygenating the patient, and now we're ready to do the treatment. So what we're gonna do is put on our gloves. Okay, we're gonna be removing the oxygen source, or put it nearby, and then we're gonna be removing the soil dressing. Okay, after removing the soil dressing, you just discard that along with your gloves, and then you're gonna do hand hygiene. Okay, you're gonna be opening your kit away from you. Take this sterile glove here. You want to pick up this white chalk where there's a flop, or you can actually handle the shiny part. Just make sure it doesn't touch the bottom when you open it. Okay, you want to only touch the border, the 1-inch border, and then set it there. Okay, and then for the content of this one, you want to pick it up, try to pick it up under, so you don't break the sterility of the contents inside. You want to just dump the contents into the sterile field. just the container here that we want to fill with sterile normal saline. Want to fill all of the containers with that, and then on the top here we want to add also hydrogen peroxide to become our soaking solution. So that solution is 1:1, one part hydrogen peroxide, 1 part sterile normal saline. Okay, so now that's the sterile area. We have the solution there. We're gonna be putting on our sterile gloves. Okay, with the non-dominant hand, I'm gonna pick it up on the cuff and then slide your hand. Make sure that the back will not be rolling, so I just pull it from the back too. Okay, and then this one is sterile, so you want to get the sterile part of the glove, which is under the cuff. Pick it up and then put on the same, and then make sure that it's not gonna roll in the back, and then you just put it down. So I'm going to be rearranging my supply. And then I'm going to put my sterile applicator onto the sterile normal saline for it to be able to be soaked and done. Okay, so you have that there. Okay, so now we're gonna be unlocking the inner cannula and removing it. So we're gonna unlock and then remove it. You want to remove it along its natural curve, and this would have secretion. So you want to put it in the soaking solution of hydrogen peroxide and saline. Okay, now that that's there soaking, you want to clean it. You want to take this brush and then you want to brush off the secretion. Okay, then you're gonna put it in the normal saline to rinse. And you can just discard the brush. Okay, and then you want to pick this one up, and then you want to let it dry before you're putting it back on. So, okay, once this is dry, you put this back. And then lock it. Okay, now that that's done, next thing that we're gonna do is clean the area. So we're gonna clean the stoma with the sterile applicator. We're gonna clean it outward. Okay. You wanna clean the faceplate. And then we're gonna clean under the phalanges. Okay, now that that's done, what you want to do is take a gauze and then pat dry the area. We're gonna pat dry the area because you want it to be dry to prevent skin irritation and to prevent infection. Okay, just discard the gauze. And next, what we're gonna do is change the tie for this patient. So how you're gonna change it? You need an assistant to change this. Someone needs to be securing the wings so that it doesn't be disconnected. Okay, so we have an assistant during this procedure holding this and stabilizing this area. Okay, so we're gonna be, just imagine that we have someone. Okay, we're gonna be discarding the old tie. We're gonna get the new tie, and then we're going to be putting it on. And then when you put the tie behind the patient's head, you want to make sure that there are no twists and it's just all straight. Okay, so you have the patient, have the secure, no twist on the tie, then you try to insert it. Okay. Okay, and then you're gonna be tying a knot. Two knots. Okay, and then once you tie the knot, you want to make sure that 2 fingers can fit within there. 2 fingers. So that it's snug but not too tight. Okay, after that you can put on the dressing. Put on the dressing for the patient. Okay, and now where the knot is, we're gonna get a 4x4 and fold it, and then we're gonna fold it where the knot is. This is for patient comfort, so it does not irritate them. Okay, and you just grab a piece of tape. And don't tape it on their skin, just taping the gauze. Okay, and now that that's done, you can discard your trash. Okay, you can discard your gloves. Okay, do hand sanitizer. We're gonna put the patient back into the position that they want to be in and lower the bed, and we're going to be giving them back their oxygen, putting back their oxygen source, and we're gonna lower the bed, put it in whatever position they want to be in. We want them to have the call light within reach. Don't forget the call light. And after hand sanitizing again, and then we want to document the procedure and make sure the patient has no complaints or issues during the procedure. Thank you.